My name is Laura Barba, and I'm 21 years old.
My name's Erica Barba, and we're twins.
I experienced a lot of anxiety and stress that prevented me from being able to take tests in school. So when I changed from a pediatric doctor to a primary doctor, I brought this issue up with her, and she started doing an exam on my throat, and she recommended that I go in for a ultrasound. From what I've read, there's various symptoms for thyroid cancer, but I hardly had any. It was mostly just stress levels. I was kind of surprised in finding out that we both got diagnosed as twins, because my family doesn't know if we're identical or fraternal. So I was like, oh, this must mean we're identical twins then. And so we were going into it more. And I actually asked Dr. Kwan if we can find out if this is a genetic thing or environmental thing. I thought that was kind of interesting because we've grown up together, so it can be both. It can be genetic or it can be environmental.
My symptoms, I based them off of my sister because I previously saw what she was going through, and I realized that I started getting really bad test anxiety. So I figured, oh, I'm just going to go and ask my doctor. And then my primary doctor, who I had at the time, because I mentioned that my sister had it, she said, oh, we'll just go check, just to double check. I doubt you don't have anything, because they didn't feel anything in my lump, like no lumps compared to my sister. So they did a biopsy. No, first they did an ultrasound, and they found a very tiny nodule. But since they just want to be safe, they sent me to Dr. Kwan to get a biopsy, and then they found out that I had cancer, but it was a very small chance. They didn't think that I was going to have anything, but it came out positive in the end.
My treatment involved having to go in, from the very start, ultrasound. After an ultrasound proved that there was a nodule in my throat, they had biopsy done. The biopsy results came out positive, so we had to go and see Dr. Meany. So then he talked over surgical procedures and what I would have to do, what to expect. After surgery, I went in for radiation treatment to ensure that cancer that might have spread in my lymph nodes were completely killed off and there was no trace left. I had radiation treatment in Holy Cross Hospital.
My reaction was, I saw my sister already, and I knew that I can do it because she was able to do it before me. And then because mine was so tiny, I think mine was 5 times smaller than my sister's was. So I figured if she can do it, then I can do it. And then she was there for me, so I knew that she'll be there. He was nice. I actually went in with my dad, so he saw him and he was like, oh, I know you, you're my patient. And so then he saw me, he goes, didn't I do surgery on you already? And then he goes, oh no, you're the twin of my other patient. So then he would ask me, oh, how's your sister? And then I would tell him, and then he'll ask me how she's doing, if she's taking medication, if everything's all right. And I told him everything was fine. And then he would ask me, oh, he told me the same thing, oh, if you want, I'm going to make your scar even smaller because I don't want to have to do a big cut, because usually the cut's from all across your neck for thyroid cancer. But he changed that. Dr. Meany is my worries because he always had a big smile. And then he'll be like, oh, okay, everything's going to be all right. You guys are young. You guys are going to do well. Most people who get diagnosed with thyroid cancer are older. They have a hard time healing, but you guys are young. You're going to do fine. So he would always reassure us. The nurses would always ask us if we were all right. And then Dr. Meany would come in and double check and ask us how we're feeling. And then at one time, we both came in. So he had compared our cases together, checking our scars, taking pictures, showing the difference from 2 years to right after I had mine. And then he'd always ask us questions because we didn't have previous history in our family of thyroid cancer. So he'll always ask if we're feeling all right, if we have any changes in our voices, anything like that, because that can be an effect after surgery.
Now I'm very healthy. I keep up to date with doctor visits, getting blood drawn to make sure my levels are fine. I take Synthroid every day to have hormone levels, since I did have my whole thyroid removed. I have to have yearly checkups to ensure that there's no regrowths, and just keeping on top of everything with my health. I'm doing good.
I'm doing well. I was just told that I don't need to take synthroid hormones. So half of my hormones, well, my thyroid's doing well. It's keeping my hormone level normal.
This has changed my plans for life because before I was kind of always interested in the medical field, but not, it was just something that was very interesting. And I didn't really think of it as a career field until this happened and I witnessed what it was like to be a patient. And I wanted to have a good positive impact on a patient when they were going through something this scary. And then I thought, well, there's public health education, and that's talking about advocating for making sure you're healthy before anything bad happens, ensuring that you catch something before it gets worse. And I thought that's very important. And that's one of the things that affected me in my experience, because I caught it really early because I was effective in asking questions. So I thought, oh, I want to be a public health educator. So now I'm going to school to educate individuals and advocate for going to go see doctors and being on top of your health and noticing your symptoms. And I actually want to focus on the subject of cancer too.
It's changed my life because after Alora's, I knew that it was important to get checked. So whenever I have little things I notice, I automatically go to my doctor and ask her questions to make sure. And then because I was already diagnosed with such a little nodule of thyroid cancer, and because I still have half of mine, they're worried that it might come back. So I go back every year and get an ultrasound to double check to see if everything's fine.
For other individuals who face the same diagnosis in cancer, I think I would probably say that they would have to really pay attention to their symptoms and not be afraid to share information with their doctors, because it plays a key role in what the doctors have to do and like going into your procedures. And if you say something and you don't back it up with other information, there's no way of doctors knowing what you're going through and being able to help you. So in order to have a more effective treatment with doctors, you have to go and be honest and don't be afraid. And it always comes out better. I don't understand why patients would be afraid when they're going in there for help in the first place. And that's the only way they're going to get treatment.